Hello everyone, I'm Hoang Phan, who is a postdoctoral research fellow at Menzies Institute for Medical Research, University of Tasmania. First of all, I'd like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past and present. I'm very honored to present our meta-analysis of the association between antihypertensive medication and the severity of COVID-19. The authors have no conflicts of interest to declare. COVID-19 caused by the severe acute respiratory syndrome has been spreading worldwide. Studies in animals show that angiotensin converting enzyme or ACE inhibitor and angiotensin receptor blockers ARB may upregulate ACE2 expression. Uncertainty exists over the harmful effects of antihypertensive medication on the severity of COVID-19. Our aim was to investigate the association between the severity of COVID-19 and the use of antihypertensive medications by performing a systematic review and a meta-analysis. We have searched 3 databases from inception to May the 3rd, 2020, using relevant search terms related to COVID-19, ACE inhibitors, ARB, and other antihypertensive medications, including beta blocker, diuretics, and calcium channel blocker. We performed meta-analysis using random effects model to compute overall effects odds ratio of having severe COVID-19. The severity of COVID-19 was defined as requiring intensive care, having septic shock, requiring mechanical ventilation, or being dead. Out of identified 134 articles, 10 studies with a total of 24,132 patients were eligible for being included in our meta-analysis. Of them, 12% has severe COVID-19. As you can see from the first forest plot here, the diamond illustrates the pool estimates of having severe COVID-19 among those treated with ACE inhibitor from 5 studies. And the heterogeneity was tested using isolated statistics. The use of ACE inhibitor significantly improved the severity of COVID-19 with a pool estimate being 0.58. And the isolated statistics was at 85% with a significant heterogeneity. In the bottom forest plot, no increased risk of severe adverse events was found to be associated with the use of ARB, with the pool odds ratio from 5 studies was at 0.85. And again, the heterogeneity between studies was significant. Let's move on to the next slide. This graph shows no increased risk of severe adverse events among those treated with beta blocker from 4 studies, with odds ratio being 0.96. And it can be seen from the bottom graph, similar results were observed for the use of diuretics, whereby the antihypertensive medication did not increase the risk of having severe COVID-19, with the pool odds ratio being 0.95. Lastly, only calcium channel blocker, or CCB, was associated with higher risk of more severe COVID-19. COVID-19 patients treated with CCB were about 16% more likely to have adverse events from 3 studies, although not being statistically significant. Key messages to take away are as follows. Most antihypertensive medications appear not to increase the risk of having severe COVID-19, if not improved the outcome of the disease, particularly using ACE inhibitor medication. However, CCE could be harmful in the COVID-19 patients. Randomized control trial will be necessary to provide insight into the roles of ACE inhibitor, ARB in other antihypertensive medications on COVID-19 patients. I would like to thank you for your attention. And if you have any question, please send me an email through thi.phan@utas.edu.au.